guys, welcome to the Truth Be Told podcast. My name is Erica and this is Brandy.
Hello, everybody. I am a registered dental hygienist with a local anesthesia permit, and I've been practicing in the dental field for the last 20 years.
Yay! And I have not. If you're joining us for the first time, our podcast is focused on providing underserved and underprivileged communities, particularly people of color, with the information and tools to help them improve their dental health care experience.
Yes, ma'am. As
Okay,
always.
so today's episode is about diabetes. So
Yes,
we're just gonna, dive into the effects on your dental care or your teeth in regards to that. All right, Bran.
yeah, so diabetes and your oral health. So, and if you guys didn't know, they have a higher than normal risk for gum disease or periodontal disease. That disease destroys the tissues in the bone that hold the teeth in place, so the gum tissue and the jawbone. And this is due to poor glucose control. So you're more susceptible to having it because of that. So the main thing we should focus on is controlling our sugar levels. That's going to be a really good way of making sure that your gum health is in check. So you control your glucose and sugar levels, and you're going to be less likely to be as susceptible to acquiring the periodontal disease or the gum disease. Okay, so diabetics with poor blood sugar control, they are going to be they're going to have periodontal disease more often and more severely than diabetics who have great glucose control. The diabetics who have really good glucose control are not adversely affected by periodontal disease. They're kind of just like me and you. So
Mm-hmm.
I don't have diabetes and I don't have periodontal disease, but somebody who has it and controls their sugars very well also will be less likely to have periodontal disease.
How does periodontal disease develop?
So the gum disease, that's an infection of the tissues, like I said earlier, that hold the teeth in place. Plaque builds up and it hardens under the gums, and the it starts off soft as plaque, and once it gets hard, it turns into tartar or calculus. That usually takes about 24 to 72 hours to happen. And once it gets hard, you can't remove it on your own. You have to have it professionally removed. However, while it's sitting there, there is very aggressive bacteria associated with that tartar and calculus. It causes inflammation of the gum, and it will destroy the tissue in the bone in place. So if your gums bleed, it's not normal. It's never normal. That means something's happening. Something's going on. Your gums are trying to tell you something. So that's what happens. So the infection can lead to loss of the bone that holds the tooth in place, so the actual jawbone and the gum, which means you don't have a stable place for the tooth to reside. The teeth become loose and you lose the teeth over time. So that's the end result of having periodontal disease that is unchecked.
And what are the warning signs? I guess some of the stuff you were saying about.
Yeah. So sometimes, it's funny, Erica, because sometimes people won't have symptoms, but they will. So, for instance, bleeding gums, right? I just said that, that's never normal, but people think it's normal. So they'll come and they'll be like, oh, my gums always bleed. They always have bled. So
No.
in their mind, it's their normal, but it's never normal. So some people don't understand. So that's not going to be a symptom for some people, if that makes any sense. It's not going to compute that, oh, my gums are bleeding, I have an issue. So they're going to assume that, oh, my gums have always bled. This is just what my gums do. And I always try to tell patients that the gums are very picky. And if there's like things around the gum, like plaque, which is soft, the gum will act up. It'll act right up and it'll be like, okay, I can't talk to you, but I'm sure enough gonna be sore. I'm sure enough gonna be bleeding. I'm sure enough gonna be, uncomfortable when doing normal things. It's a way of communication. So bleeding gums, if you're brushing, if you're flossing, even if your gums don't
Mm-hmm.
hurt and they're bleeding, you need to get them looked at. If you have red, swollen, or tender gums, if the gums have pulled away from the teeth, so part of the tooth root might be showing, it's called recession. So that your tooth may actually look longer when you look at it, and that's a portion of the root.
Long in the tooth.
A little long in the tooth. Okay, more ways than one.
Mm,
If
mhm.
you have any pus in your teeth or in between the gums, if you have bad breath, aka halitosis, if you have loose teeth, if your permanent teeth are loose and they're kind of
Mhm,
shifting away from each other and moving around, uh,
mhm,
if you have changes in the way your teeth fit together when you bite down, or if you wear partial dentures, if your denture is starting to fit differently when you put
mm.
it in. So those are all kinds of signs that something's going
And
on.
what treatment is available?
So it can be treated by what's called a scaling and root planing or a deeper cleaning. So we go below the gum line to remove the tartar plaque, the bacteria, smooth out the root and remove the toxins from
Mhm,
below the gum line. So you get numb for this procedure so that you should be comfortable. Sometimes they do gum surgery called osseous surgery, but a specialist will do that, like a periodontist, that's a gum specialist. That's for more advanced cases. Um, but that surgery consists of the dentist cleaning out the infected areas below the gum, reshaping the bone around the teeth. But I just want to add, y'all, that these treatments are only successful if you regularly floss and brush and keep up with your dental home care. Otherwise, you're going to be building up plaque and tartar again. These are not routine procedures. They're not, oh, I'm going to get my scaling, my deep cleaning in 2 years. People come in and say, oh, I always get a scale. Well, you're not supposed, that's not the point. We don't want you to keep getting it because that means you're not doing something. So the success
mhm.
of the treatment depends upon you as the patient and what you're
Yeah.
doing on the day to day.
Mhm.
So that's what it comes down to.
Okay. What other mouth problems may diabetics experience?
So a lot of oral infections because the glucose level is unchecked. There's a lot of cluster of germs in the area. So you can have swelling or pus around your teeth. You can have pain in your mouth or also in your sinus area that just is not going away. There could be white patches on your gums, on your tongue, on your cheeks, or on the roof of your mouth. Sometimes they can be sore and it may hurt when you drink or eat certain foods. Um, if you have any pain when you're chewing, if your teeth hurt when you eat something hot or cold, or when you chew, and if you have dark spots or visible holes or breaks in your teeth. So those are all things that
Mm,
it's a lot. It's a whole bunch. It sounds like a lot, right? And then,
mhm.
of course, you can have fungal infections. I think we talked about in one of our episodes, Erica, about thrush. And actually, I think that was the first
I
oral
remember talking about thrush, yeah. Mhm.
talk about thrush. And so thrush
That's the
is
white when you sorry.
white patch. It's very sore. It doesn't feel good. It hurts. And,
Mm-mm.
fungus thrives on high glucose levels. So in the saliva. So if your glucose is off the charts, it's going to be way easier. And most of the patients I have
Mm-mm.
that have thrush as adults, they have all had diabetes. Um, if
Mm.
if you wear a denture or if you're a smoker, that helps to breed the fungal infections as well. Um, so you just want to, if you wear dentures, make sure they're nice and clean every day. You want to prevent that. It's not fun getting that thrush. And then you also have poor healing, as you know,
Mm.
Eric. I'm sure
Oh,
you
yeah,
heard
of
diabetics, they heal poorly.
course.
People,
Absolutely.
they have to get certain. Sometimes you have to get things amputated and such when you have unchecked
Mhm.
diabetes. So just imagine what's going on inside your mouth if you have poor healing in other parts of your body. Your mouth is a part of your body.
Mhm.
And lastly, a lot of diabetics can complain about dry mouth, also known as xerostomia. So people can have dry mouth from taking medications as well. That could be part of it, but most of it is just from the glucose being unchecked and being so high, it causes dry mouth. And a lot of patients complain about that it's uncomfortable to take dentures in and out. Um, it's uncomfortable to eat and drink the way you normally would. If you can imagine, swallowing food is difficult when your mouth is really dry.
So what is the recommended home care?
Okay. Well, listen, you want to be brushing for at least 3 to 5 minutes. That is roughly the length of a song. So you want to do small, gentle circles. Make sure your toothbrush bristles brush over your teeth, as well as massage the gum line gently. You never want to use medium, firm, or hard toothbrush bristles, only soft or extra soft. So the key is to brush longer, not necessarily harder. Okay, so that's at least
So
times a day.
why do they make those toothbrushes then?
Yeah, I don't know. I don't know. It's a good question. People be asking me, and I'm like, I'm not sure because they over time will destroy the gum tissue,
Mm.
okay, and cause recession and such. So I don't know, but I
Get
have
it.
patients that are like, "Oh, I don't feel like I'm clean." And that's because you're scrubbing so hard for like 2 minutes and it feels good. But if you're brushing longer, 3 to 5 minutes, and gently, and it might be hard and crazy and aggressive, you'll feel better. But I don't know why they sell them. Eric, that's a good question. I wish I knew. I wish I knew.
Yeah.
The other thing is that you need to be flossing at least once a day. So at bedtime is the very best time because if you fall asleep, you don't want to fall asleep with the day's debris on your teeth. So whatever you ate and drank, you don't
Yeah.
want to do that because you inactive for the next 7 to 8 hours and just letting all that
That's true.
bacteria breathe.
Yeah. It's so funny because I lay in the bed and I'm like, oh, me.
Gotta get up.
Like,
Get up.
like especially when I'm in the bed and I'm like, I'm about to fall
And
asleep.
that sleep,
I'm about
that's
to get
coming
this
on
sleep
you.
in.
It's feeling good
And
to
then I'll
you.
be
And you
like, dang, I gotta get up.
cozy up.
But their water pig is working really good.
So water pig is fine if you're having issues flossing. Some people have dexterity issues. Some people just aren't going to floss and they don't want to, and that's your business. As Auntie Tab would say, it's your business. But do something like if you're going to do something, do the water pig. That might be simpler for you, and it's all good. I'd rather you do something.
It's fun too. It's fun when you're in the shower.
Yeah.
And you're like,
Yeah, it probably feel good afterward. You know what I'm
do
saying?
it in the shower because
Yeah, in the
I've
shower. 'Cause
definitely
it
had
keeps
problems. And then you gotta be cleaning your mirror off and all that kind of stuff and all that jazz.
Yes,
You don't
it could
want
be
that.
messy. And if you wear full or partial dentures, make sure you're cleaning them daily. You brush them like we talk about in the denture. Check out the denture episode if you don't know. But remember to take them out when you sleep. Yeah, you want to do that so you can make sure your gums are healthy. So that's the recommended home care.
What dental visit considerations are there for the diabetic?
Okay, so as a diabetic, you should be visiting your dentist regularly. Of course, let your dentist know if you're having any problems inside your mouth, any infections, any trouble keeping your blood glucose under control. But you want to always make sure this is super important. You always make sure you eat before you go to the dentist. Very important because the glucose levels need to be in a safe range for you to have any procedures done. And so that dental work, will heal well as well. So, and it's okay for it to be on a little high, which is all right when you're having any kind of procedures done. Always, always, always take your normal medications before you visit the dentist, unless your dentist or doctor tells you differently. Please don't be self doing stuff because patients come in all the time like, oh, I knew I was getting a cleaning, so I just stopped taking my aspirin. Okay, well, no, don't just stop taking stuff. Like, unless somebody said, you can't do that, please just take your normal medications. That's it. No questions asked. You want to always follow your normal meal plan. Please follow whatever that is. If that's eat, of course, we want you to eat right before, but if that's eating right after, because we want to make sure the glucose levels are safe, right? So you want to do all that because you're not going to be able to chew as well after dental work. You're going to have to probably wait till numbness wears off. If you have extractions, you're going to be having soft, cool, mushy food. So just make sure you keep up your normal meal plan. And if your blood glucose is poorly controlled and you're scheduled to have dental surgery, you're going to have to talk to the dentist prior to, so you'll probably have a consultation because you may have to postpone the surgery because you won't be able to have it done for healing purposes. So it's a lot to consider for diabetics. They got a lot going on for oral health, right?
Yeah.
Didn't it seem like a lot, Erica? Like I felt like
It
I was talking
seems
and talking.
like, yeah. I was just thinking that too. I was like,
it was a lot happening.
I just sat here most episodes listening. Like,
Yes, because it's information. There's so much going on with diabetics. So if you're diabetic, it's controllable and you can do it. Just it's some considerations to think about.
Yes. All right. Well, another awesome episode. Lots of information. Thank you so much, Brandy. So you guys, as always, tune in to our YouTube channel. You can catch that on our website, www.toothbetoldpodcast.com. And like, share, and
Comments.
comment. Yeah, if you have questions, Brandy will hit you back. Okay.
Erica, you don't realize this, but you hit us with the www. Child.
I did.
You did. That's like old school. That reminds me of Robert Stack on Unsolved Mysteries. Remember he was like www.
WW. Oh my God.
Because we used to say it back then.
Oh my God. I did, didn't I? I don't know why I said that. Well,
It's
because
funny.
no, I
It's
said
just part of like that's what we do. I've done that before in the past.
I'm a Gen X. I'm a Gen
Yeah,
X.
that's what I'm
I'm at the end. Like somebody saw, they said a Zennial, because it's like
Is that
at
what
the
it's
end
called?
of, because it's near a millennial, but it's a Gen X because we're at the end.
Okay. I like
Zennial.
that.
I guess I got a little bit of millennial in me, but mostly Gen X.
Look, I'm a proud Gen Xer.
Me too.
Proud.
Either. All right, guys. Thanks so much.
Yes, guys. Take care. We'll see you next week.
All right. Bye-bye.